at Army Civic Hospital and St. Joe's, Toronto. I've been working as an emergency physician for 9 years.
So my name is Joan Cheng. I am currently the Chief of the Emergency Department at St. Joe's Unity Health in Toronto. I have been practicing emergency medicine since 1996.
Hi, my name is Prashant and I'm an emergency physician. I've been working for almost 14 years now and I work mostly at William Osler Health System in Brampton.
My name is Rebecca and I'm an emergency doc. I work at William Osler at Brampton Civic and I also work downtown Unity Health, so at St. Joe's. Questionable, yeah.
You failed. Yeah, that was. Oh.
No.
You guys eating the cheese.
If it touches the wrist.
You've never played before, okay?
Why does it?
No, it doesn't.
Well, I definitely have quicker reflexes, so I think I'd kick his ass.
I was one of those learners who wanted to be doing whatever rotation I happened to be on. So I was like, oh, I love pediatrics. I definitely want to be a pediatrician, and I'm really enjoying ophthalmology. Maybe I should be an ophthalmologist. So how I ended up in emergency medicine, when I think back on it now, I realize it's because it really frightened me. And I thought, the only way I can get over this is to spend more time doing it. Every time I did an emergency medicine rotation, I ended up working with people that I really admired, looked up to, but they really kind of lined up with how I could see my life being. And
I remember in high school in the 1990s watching the show ER and being fascinated by the job. And I remember thinking to myself, oh, I want to do this one day. What I really thought I was going to do initially when I first graduated was become a rural, comprehensive family doctor. As I did more training, it became clear that what I really wanted to do was focus all my attention on emergency medicine.
I didn't plan on becoming an emergency medicine doctor when I went into medicine. I really liked pediatrics. I had kind of lined myself up to do everything in peds. I saw emerge as something scary, something fast, something beyond my skill level. And I had my first rotation in third year med, and I heard Rebecca Brown called overhead to the resuscitation bay. I walked in, and there was a guy there, and his heart rate was going really fast. And my staff looked at me, and he's like, "What do you want?" I was nervous, but called for a medication that I thought would be helpful, and he let me push it, and we fixed the problem. And I remember my adrenaline pumping, and going home after shift, and going to my roommate, and I was like, "That's it."
I clearly remember this. When I started med school, my goal was to go into orthopedics and pediatrics the week or the month before CARMS. I did my emergency medicine rotation. And I remember going to my first shift, and honestly, I fell in love. Just all that chaos, it just spoke to me, and I was like, oh man, I need to go into emergency medicine. And I made that decision that day after that first shift, and I've been in emergency medicine ever since, and I've never regretted it.
I mean, for me, it's the variety. I find it myself to be a generalist at heart. I like the fact that any day you walk into a shift, you have no idea. There's no way to predict what's going to come in, and you have to be prepared for everything. And so
you have these moments when you're taking care of a critically ill patient. You're in the room and you're leading a team, and nothing else exists. You're so present in that moment, and I think there are very few things in life like that. And it's a bit addictive.
I think people think emergency medicine is all about kind of dramatically saving a life, and that does happen, but not that often. What really gives me a lot of joy when I work is being able to reassure patients that everything's going to be okay, to alleviate their anxiety and like visibly see this look of relief across their face. To me, then that's a good day.
When anybody walks into the emergency room, it always seems like chaos, but it's not chaos. And I call it chaos, and it's my fault for calling it that as well, but it's not. It's this beautiful rendition of music where you're seeing people who are really sometimes at the worst they've ever been, because the sense of being able to do something right then and there and being able to help someone when they really, really need it, there's just nothing better than that.
because it's really, really fun. It's a wonderful job. It's a job where you just feel like you're going in to play, and it happens to be a job, which is pretty amazing.
Regardless of where you are in this country, we all deserve high quality emergency service. To me, that's just a basic human right. So on our worst day of the year, we know that we're going to be taken care of.
There are things that you want to be able to do for your patients, and for whatever reason, sometimes you can't do that. And it's related to the resources that are available or not available. Having worked for almost 3 decades, I've really seen various iterations of resources not being available. I will say, our situation now is very much unlike anything that I've ever encountered before, for sure.
You walk into the emergency department and there's stretchers lined up with a hallway, and people are going through crises in their own world, and they're stuck being seen in a hallway. That always hurts, and there's no way you can be okay with that.
At the heart of it all, I am an optimist. I know that things will get better, because they always do.
It's not so much emerge, it's the system, I think, that causes frustrations. Emerge is this big, vibrant, social beast. Finding your community, we really come together and bond together, is really important. People that you trust to debrief what you've seen is crucial.
There's colleagues I talk to pretty much every single day, from the morning to the night, about cases, about just what's going on in life. So we kind of just know each other so well. So when you're in that chaos, when you're in that zone in the emergency department, you have people that are just not your colleagues, but true friends that you can rely on.
You need to have that peer support, because emergency medicine does that really like nobody else's business. We have a ton of people that we work with, and those people you have to rely on so much to be able to do your job well, but also to support you in good times and in tough times.
You see a lot of personal things where you have the sort of privilege to be there and be the person for that family and that patient in that moment. Those are the cases I think that stick with me.
There's a lot of cases that I'm probably never going to forget for the rest of my life, and some have had great outcomes and I won't forget them, and some have had bad outcomes and I won't forget either.
I don't think there's one specific prototype. I think it's a very personal decision. You should really enjoy it. So go do shifts in your first, second year of med school and clerkship. And if you're really enjoying yourself, that's a pretty good signal that this is the type of work you want to potentially pursue.
Things that are really important to me are notions of loyalty. That sense of loyalty really translates into the fact that I am going to be there for everybody in my department.
Emergency medicine is a team sport, hands down. If you come in to believe that it's not the specialty for you.
To me, emergency medicine is a primary care specialty. We do a lot of primary care. And so if that's something that upsets you, bothers you, you don't like it, that's not going to make for a satisfying professional practice.
Right? My ideal colleague, it's somebody who's kind,
Being kind
who's understanding,
and compassionate
who's motivated,
and patient-centered.
and somebody who's willing to learn from their mistakes and willing to grow as a person. 100%.
Yeah.
I love what I do more than I loved it when I first joined.
Emerge is really, it's the best. It's super fun. You get to help people every day.